Hello, all. This is Dr. Dheeraj Masapu, and I'm in Africa now. I came for a 1 week camp in Africa, where we came for observership in a hospital in Tanzania. So this is part of anesthesia patient safety forum in India. 12 anesthesiologists have come here, and we have observed and gave some suggestions to the anesthesia practices which are happening in Tanzania, Africa. So this video, I would like to tell some of my doctor colleagues, not only anesthesiologists, some of the doctor colleagues. Before starting video, you can look at Tanzania. So I'm staying in one of the hotel. So that's the sea actually. That's the Indian Ocean. You're seeing, you can see it my finger. So it's a, before coming to Tanzania, I was thinking that Africa is like all the forest, jungle, all the lions and tigers would be there, but I was totally mistaken. After coming here, it is almost equal to some parts of Bangalore where I stay, and even the cost of living is less, but the quality of life is good. You can see the traffic and all that. From here, the traffic is actually very well organized. Roads are very clean. They're keeping the roads very clean. Everybody, is throwing the garbage in the dustbins and maintaining a very good thing. So this video is about what kind of opportunities doctors have in Africa. Let me tell you the demand-supply mismatch which is there in Africa. So there are some specialties like anesthesia and other specialties where very few people are there in Tanzania. So the reason being, maybe the number of students that are being produced is less in African countries. Okay, so they would require lot of doctors. Okay, luckily your Indian degree is actually valid in Tanzania or Africa and other places, with some kind of assessment that the hospital would do before taking you. Okay, because demand is there, they would obviously recognize your degree. As a matter of fact, other countries like Australia, USA and Canada also are recognizing, so there is no wonder that Africa is actually recognizing. And the second important thing is, you can get a job in good hospitals, and some of the hospitals we have seen are very well equipped with all the latest equipments and gadgets. There is a cardiac center I saw every day. They are doing a lot of pediatric cardiac surgeries here. Okay, so imagine people, I think if a cardiac anesthetist is watching, pediatric cardiac surgeries are not very commonly done, but here there is a waiting list. So every day they do pediatric cardiac surgeries. So that is the level of patient volume that you have and equipment you have. If you have good skills, if you learned good skills in your country, then this is a very good place to work. Coming to the financial aspects, I think you guys are interested in this aspect, right? So financial aspect wise, you will post-MD person or post-MS person, you will earn more than India. That much I can tell. I came to know the numbers here. The little variation is there. Above 5,000 to 6,000 American dollars is what you get in a month. And if you stay here for 3 to 4 years or up to 5 years, you can touch up to $7,000 to $8,000 also. And Indians who are staying in Africa for more than 3-4 years, they start their own businesses also, because there is a lot of scope for business development here. Some Indians are into making hospitals, diagnostic chains. Some Indians are into buying lands. I think somebody was telling lakhs of acres of lands Indians bought, and they're doing farming here. And there are so many businesses that Indians are doing in different parts of Africa, in Tanzania also. If you, over a period of time, if you get into those things, you can make real money, because the competition is less in any field you enter here. In India, you have to compete with brightest or the brightest. So why do you want to fight in that competition? Why don't you actually come to places like this? If you want to actually connect with somebody here, I have some contacts since I came here. I can help you maybe in getting in touch with the people. So build your skills. If you are independent operating unit, only then you can work here. So immediately also you can come, maybe 6 months you work in a place where independently you do the cases, and after that if you come here, then actually you can do, whether you are a surgeon or anesthetist or whatever specialty you are, you will get a lot of experience. If you really feel that in India you're not getting chances, you're not getting the opportunity to actually practice and then build the skills, you can come here, earn money and build the skills also, because large volume of patients are in the waiting list. So you can build your skills, and then you can actually go back to your country if you want after making good amount of money. But I feel you can settle here also. Look at the country, how it is there. You can actually settle here also. And I've seen a lot of Indians who are settled here. I was really shocked. The hospital where I was doing, the next hospital is called as a CP hospital, and there is an anesthetist Indian. I don't want to mention her name, but she is actually working there. She is gone for a maternity leave, it seems, but she is working there. Even her husband is working, so they both would be making a lot of money. And here taxation is less. The whatever amount I told is after taxes. In India, after you earn, you have to pay 30% tax. So here taxation is in a different way. You have to pay for some kind of thing that told I forgot. But so overall, whatever amounts I told is after the tax reduction. So I think see, Africa, if you think there are is not developed or something like that, if you're thinking, then you should see this video. Things are changing. I think you have better opportunities in Tanzania than India, is what I am feeling personally. Okay, I am not in the age to actually come and settle here because I am in a senior position in India. Otherwise, if I am a junior like you, if I am in the post-MD or post-MS period, who wants to have good exposure of cases, who wants to earn decent amount of money, who wants to actually independently do the things which you cannot do in India, you can do here. Got it? So this is a very positive video about Africa, and that is the feeling I really got after coming here and staying here for a week. I am not doing this video by taking information from somebody. Since 1 week I've been working here. I've been interacting with the biggest guys of the healthcare who are actually dealing who are actually in leadership positions in Tanzanian healthcare. And after talking to them, I realized that there is a lot of scope, there is a lot of opportunity in this particular part of Africa. I don't know about other parts of Africa, but this part I can tell. Okay, coming to safety wise, this is extremely safe is what I feel. See, crime will be there anywhere. Even in America, crime will be there. India also, night after 10 o'clock in Bangalore, crime is there. Like that, everywhere that part of crime will be there. So they usually recommend not to go outside after 8 o'clock or 9 o'clock in the night. So that I recommend even in India. Okay, so if you are within your bubble, within your home, and everything will be safe. Coming to infections and all that, you just have to take Japanese encephalitis vaccine. Other than that, nothing else is there. Everything is very clean and damn clean. I didn't even see one mosquito or a fly after coming to this place. So that's it, guys. So that's it about my trip to Africa, and I was very happy that we could actually meet the Indian High Commissioner, who is the Indian Foreign Services bureaucrat who is in the place Africa, and he actually wanted more Indians to actually come to Tanzania, even for investment, even for jobs, opportunities, and he wants a good collaboration between India and Tanzania. So that is his intention. And even the healthcare people, when I spoke to them, they want to encourage this kind of exchange between the doctors. They want to come to our place, and we should also go to their place and see. Mutual exchange of the strengths is what they are looking at. Okay, so thank you, guys. So there is a link in the description for my mentoring. If somebody really wants to think about, I will just come out of my comfort zone and do something different, and there is a link in the description. You can actually click on that, and you can directly talk to me, and I can help you and guide you maybe in taking a different adventurous journey. And a lot of safaris are there. I didn't get time this time. Maybe next year I will go. So you can actually see a real wildlife here. It's a little far away from here. It's called Serengeti National Park. Okay, and then in that particular national park, you can actually see annual migration, it seems now. So they migrate from one part of the Kenya Masamara National Reserve to Serengeti National Reserve. There is a river in between. So when zebras and all these animals are actually migrating, crocodiles would be feeding on them. So to look at this scene, a lot of people actually come and they park their vehicles there and see. This time I couldn't get time to see, but next time I think every year I would be coming here. So next year maybe when I come, I would surely go for that. So this time I just came to understand how this part of the world looks like, what are the opportunities here. Okay, thank you, guys. Thank you for following the video till the end, and thank you very much. As usual, Dr. Dheeraj Masapu logging off. Roger that.